Growing up with a growing understanding speech pathology. Conversations about children's development that will support you through your parenting journey.
Hi, I'm Lauren from A Growing Understanding, and welcome to the Growing Up podcast. This is where we have real and practical conversations about children's communication and feeding development, helping parents to feel supported, informed, and empowered. Each episode, I'll sit down with one of our amazing team members to share insights, answer some common questions, and give you some useful strategies that you can take into everyday life. So whether you're wondering if your child may need some support or looking for some tips to help their progress, or perhaps you might like to better understand their journey, this podcast is here to help. If this sounds like it may be helpful, make sure to follow along and let's get started. Welcome back to another episode of Growing Up with A Growing Understanding. I'm Lauren and I'm the owner and practice director here at A Growing Understanding, and today I'm joined with Holly. Holly is one of our speech pathologists and is one of our clinical leads, and she works across two of our two locations, Adamstown and Warners Bay. And so lovely to have you here, Holly.
Hello, thanks for having me. I'm super excited to be on the podcast.
It's nice to have it up and running, and we've spoken about lots of ways that we can engage families and share some of the information. And today in particular, we're going to be talking about when to seek a speech pathologist and recognizing some of those key milestones. So I thought that you're a good person to bring into this. You support our team in helping to support parents to know when to see a speech pathologist. So I thought that you're the ideal person to have join us on today's episode.
Thank you. That is so nice of you. No, I'm looking forward to chatting about all of these things because it's one of my biggest passions, chatting about how we can empower parents to feel inspired to support their kids when they might not necessarily feel like they can or they have all the resources. So yeah, it's one of my biggest passions, empowering parents.
And I know that it is. We've spoken about it at length before privately, but we know that parents are a key ingredient in supporting children's communication and feeding skills. So I'd really love to hear your perspective, Holly. Why is it important for parents to be able to know when's the right time to seek the support of a speech pathologist?
Yeah, absolutely. So I feel like, just as a little bit of a backstory, I love seeing parents supporting their kids. And as we know, parents know their kids better than anybody. So for them to have the tools and the strategies to be able to support their kids, that is just, the best thing ever. So because we're using their instincts to tell us or for us to understand what's happening with their child, as soon as they're feeling any instincts or they're not sure about what their child is doing or where they're at, that's the perfect time to then seek support from a speech pathologist. Because they're the ones that can make the most change.
I think that there can sometimes be a bit of hesitation to automatically see a speech pathologist. I think there can be lots of different reasons why there may be that hesitation there. I know that I've got my ideas about some of the reasons why families and why parents or carers may be reluctant or a little bit concerned about having to go to a speech pathologist for that first time. What are some of the reasons that you've experienced, Holly, about why families may be a little bit reluctant to see a speech pathologist?
Yeah, great question, because we see so many families. It all presents really differently for each family. So it's super important that we are giving that individualized advice and tailoring our supports to help them. I think probably the biggest reason that parents are reluctant to seek support is that they're not sure of where the child should be. They've got those inklings, like we previously touched on. They're not sure where they should be. They're not sure where they're at. They feel like they're going okay in certain areas, but then other areas aren't as easily learnt, or concepts aren't as easily developing as what they might think. There could be also conversations with other professionals that might be impacting their choices and their decisions in knowing what the right thing is to do and when that is too. And
And it
we
might
do
just be that
have,
they're a little bit worried. It might be, oh, I'm a little bit worried. And as you said, they may not know whether it's enough of a concern to warrant seeing a speech pathologist. So you touched on a couple of things there. One was knowing the communication and feeding milestones and whether their child is reaching some of those milestones for their ages and whether that's appropriate. And then I think the other thing is, that idea of, is there enough of a concern to warrant seeing a professional about that? As you said, whether it's seeing a speech pathologist or going and seeing your GP or going and seeing another allied health professional that might address some of the different concerns that you have for a child. So I think you touched on why it's important. It's important because it's important for a family to seek out support if they have got any concerns, but it's also really important if other people have brought those concerns to you as a parent, to know where to go and how to get the support that you need. In terms of the other thing, in terms of being hesitant, I wonder whether there's also this hope. I know that for me as a parent, when my child hasn't reached particular milestones, there's always that hope that they're going to catch up and that they're going to reach those milestones with just a little bit of assistance or more focused attention. And that's something that I think we've spoken about a little bit as well, is at what point is it worthwhile seeing a speech pathologist for an assessment and maybe some ideas that will help the child to be able to catch up, as well as, that idea of supporting and seeing rather than waiting and seeing. So, you touched on a couple of different things when you were talking about, why it's important to see a speech pathologist and why it matters.
Yeah, absolutely. And I think the communication milestones are the biggest key, or the communication and feeding milestones are the biggest key. Because if you're not sure, there's something that you can go to just as a rough idea to go, okay, well, yes, now's the time, or no, I'm just going to keep monitoring and trying things at home and then come in afterwards. So, yeah, I think my my thoughts are that as soon as you feel like there is something that you would like further information or further education on, that's the time to then come and seek out support through a speech pathologist service, which we have some really cool resources too that we can help just guide that decision on too. So we have our communication milestones service booklet here, and we also have I'm not sure, what was the other one called? Do you
Well,
recall?
we've got a few different, as you said, a few different digital downloads that are on our website. So the one that you were just mentioning just now, our communication milestones, that's actually in a resource specifically for parents about when to seek the support of a speech pathologist. Does my child need to see a speech pathologist? So it has some of those communication and feeding milestones in there. It also touches on some of the reasons or some of the times when you might want to see a speech pathologist. So you've already touched on if the child isn't meeting some of those communication milestones, but some of the other things that come up are also if you notice any regression in skills, so where they have actually done or said something previously and can no longer do those skills, that would be worthwhile seeing a speech pathologist to inquire about that a little bit further. We know that, that point of concern. So if there's something that's worrying you about your child's communication or feeding, it is worthwhile getting the opinion of a speech pathologist who can assess and guide you and support you to be able to make a determination about whether any ongoing support may be helpful to you and your family. Stuttering is one that we really encourage you to seek out support early for. In the past, that was something that it used to be that we would tell families to wait 6 to 12 months before seeking assessment and therapy for stuttering. But we now know that the sooner that you can get advice and information about stuttering, then the better. And so that's certainly something that we really encourage you to do. And then the other thing that can be really important to seek advice and support early from a speech pathologist is around vocal issues. So if if you have any concerns about voice, being hoarse, husky, or any of those voice issues, and that's certainly worthwhile seeking a speech pathology assessment at that point. So all of those, as you said, sorry, that was a really big segue, but one of the, it was related, but there are a few different things that we suggest that you seek a speech pathologist input early, and they're all listed in that digital resources is where I was going with that, Holly. So
Sorry,
thank
I
you
did
for
kind of
drawing your
cycle
attention to that. Yeah, we circle back around. That drew your attention to that. And I mean, that was one of the things that we were going to come up with next was, what are some of the indicators that a child may benefit from speech therapy and speech pathology? And, I think that I guess I want to explore with you what are some of the common things that we're seeing families come to us with that may not necessarily be a big concern, but it's something that they're coming to us with. What's our bread and butter? What's in our wheelhouse? What do we commonly see families coming to us with? Oh, I think I'm asking you this because I think it's important to let families know that they're not alone in this journey, and that families often have common concerns. They might not have the opportunity to speak with some other families about what they're worried about with their children, but what are we starting to see come into our service from other parents and what they may be concerned about with their children?
Yes, so a lot of the things that I'm seeing at the moment is my child is 2 and they're not talking, or my child had lots of words, but now they're only using 1 or 2 words, or he can say this word, but it doesn't sound exactly how it's meant to sound. I'm not sure if that's right for his age or not. They're kind of a lot of the things that I'm seeing at the moment. The other thing I'm seeing is he has a lot of foods, but he's not eating a lot of foods. And I kind of explore that a little bit and go, they're eating a lot of foods, but they're not eating a lot of foods. Like, what does that actually look like? And what does that mean? And it comes out that the child isn't eating the variety of foods that their parents might be expecting them to eat, or that their siblings are eating. So yeah, there's a lot coming out around the words, the talking, the feeding, how much different like variety of foods, especially with such a fast and busy lifestyle. A lot of our kids are only eating McDonald's or KFC because they're easier and they're the quickest. So just parent education around those kinds of things is really helpful. Um, yeah, but that's where we really just want to jump in and provide that support on, hey, what is expected for this age and what is expected at this level of understanding? Yeah, so that's kind of what I'm seeing at the moment in the clinics.
Yeah, I would agree with you. I think we sort of see a few different areas like that. You touched on some of that early communication. So, under
Yes.
threes with some concerns around communication, whether it's not yet talking or not yet using as many words and phrases as other children the same age. We're also seeing, some concerns around pronunciation and clarity of speech, as well as potentially a restricted range of foods in their diet. We're
Yeah.
also seeing, some concerns regarding choking, eating, those kind of things, and that kind of all falls in that realm of the under threes. Moving into that preschool age, we start to see some concerns from families about, again, the speech clarity, and the complexity of the language that children are using for their age, and considering about how ready a child is for kindergarten and for that first year of formal schooling, and what are some of the social challenges that children may be experiencing as they're going into that formal schooling kind of setting. And then I guess beyond that, we're starting to see some concerns from families around the literacy piece as well. So,
Yeah.
my child is having difficulty at school, whether it's with their reading or their writing, as well as some of the other challenges that we've already touched on. And yeah, they're needing to seek support from somebody to be able to assist their child in that space. At A Growing Understanding, we only see children. So obviously speech pathologists have roles across the lifespan, but for us, that's what we're certainly seeing within those centres. So I like to ask this question, and we talk about it a little bit, but let's just say that you're at a barbecue and in a social setting across the over the weekend, Holly, and you have a parent that comes up to you and they say that they're unsure about whether their child needs therapy or needs to see a speech pathologist. How would you address those concerns? How would you guide and support that family to be able to help them to make that determination?
It's so funny that you say that because that happens like every barbecue that I go to. I'm sure it's the same with you. Every barbecue, there's, someone related to needing support with speech pathology. I think the biggest thing is finding the speech pathology service that is aligned with you and what you need for your family and your children. Each service is very different in what they offer, in what they're trained in doing, and also in just what they put first. So some speech pathology businesses are family first, some are client first. It just depends on what works for you and your family. So I'd be guiding the parents into looking into some different services that are available, which can be quite daunting because there's a lot to look at, and there's also a lot of different processes that are involved with that too. However, if you have a resource that could help support you making that decision, that would be something that would be super helpful to look at. So I think, Lauren, we've got one here that we use, don't we?
We just happened to prepare one earlier. No, I feel like I never want to feel salesy with this stuff, but I genuinely want to create resources that are really helpful for families in these kind of conversations, and it helps us when we come to family barbecues and
Yes.
those kind of things. But like you touched on, choosing a speech pathology service that fits for your individual needs and for your family is really important. We do have a resource about how to choose a speech pathology service. We know that we are a private practice. There are not-for-profit, there are government speech pathology services, depending on your funding models, depending upon what you and your family are needing in terms of time of appointments, and the approach that aligns with your family. Also what the services have available in terms of their offerings about the scope of your concerns for your child and what matches best. So I think that that's a good advice, is, guiding them to work out which speech pathology service is helpful. So again, that's a resource that you can download on our website. It's a free resource just to be able to help you navigate some of the options and some of the questions to ask as you're approaching different speech pathology services. And then in terms of, whether the child needs speech pathology services or not, it's always really hard for us in those situations because we can't always eyeball the child and listen to their speech, and we haven't got the full history that we're needing to be able to make that determination. But the best thing that we can be doing is giving families resources like the one we mentioned earlier that guide them about them being curious about their child and their communication and feeding, and some of the concerns that may have either been raised or that they have about their child's communication, to be able to lead them about whether now is a good time to be able to seek the support of a speech pathologist. I always say that the marker of a good speech pathologist is someone who, when they have assessed a child and determined that they don't need to see a speech pathologist, is that they will inform the parent and guide the parent and provide them with information and send them on their way with information and resources to be able to continue to review and monitor the child's communication and feeding skills over time, but to equip the parent to be able to be a part of that assessment and that determination. So I think, that's what we've started. We've kind of come full circle in this discussion, Holly. That's what you started off by saying, is that family involvement is really important. It's a big piece of the puzzle for us when we're making that determination about whether speech pathology is important and required for a child. Is what are the parents' perspectives and what's their understanding of their child's needs, because that can help to inform about whether the child is needing that support from the outset.
Absolutely. Just as you were saying that too, I was literally just going to say, because the parents and the family are what are important in this discussion to decide how to move forward, because we don't want to be doing something that's not effective or not beneficial for that family or that client because it's completely our own choice, or we haven't discussed it with the family or the parents. And it can just get all too much sometimes. We just want to make sure that, they're being looked after the best way. And the best way we can do that is by providing a service that is beneficial and supportive of them and what works for them.
Yeah, that's always our key message, is that we want to provide the support, the training and the resources to parents and carers and other professionals working with the child in order for communication and feeding skills of the child to flourish. So I think that hopefully this gives some insights into some of the things to consider. If you're worried that your child may need to see a speech pathologist, please don't be worried, and please reach out to us if there's any information that we may be able to provide you to help guide your decision. Hopefully it just gives you some insights of some things to consider, and check out some of the resources that are helpful. Anything else that you wanted to add, Holly?
No, I think we kind of covered everything. I feel like that was, good insight into what we can kind of see as speechies, and why it's important for us, for the parents, to be super involved and empowering them.
Yeah, love that. Thanks, Holly. Thanks for your time, and look forward to continuing our conversation with more topics in our next episode of Growing Up with a Growing Understanding.
Amazing. Thanks, Lauren.
Thanks for listening to Growing Up with a Growing Understanding Speech Pathology. We love helping families navigate their parenting concerns and ensuring your child can grow and achieve. Please rate and review wherever you're listening so we can continue to grow together.